When you think of the Health Insurance Portability and Accountability Act, also known as HIPAA, you may think of patient privacy and confidentiality, and that is a major part of the legislation. It dictates who can and cannot talk about your care, with whom they can talk about it, and how much they're allowed to reveal. But there's more to HIPAA than just doctor-patient confidentiality. HIPAA also governs how medical records move between healthcare providers, as well as helping employees keep their health insurance from one employer to the next. It's a multifaceted and vital part of the American healthcare system. The Health Insurance Portability and Accountability Act of 1996 is an act of Congress signed into law by then-President Bill Clinton. The key rules of HIPAA are the Privacy, Security, and Enforcement Rule. These rules protect the privacy and security of health information and gives patients rights to their health information. HIPAA establishes standards which safeguard protected health information, also referred to as PHI, that you hold if you're a covered entity or business associate. What's a covered entity? It's a term that refers to a healthcare plan, provider, or service that transmits health information in electronic format. Healthcare providers are individuals or organizations that provide healthcare services to patients, such as mental health therapists, occupational therapists, pharmacies, or licensed social worker. A healthcare plan is a type of insurance that covers medical expenses for individuals or groups. And a healthcare clearinghouse is a middleman between a healthcare provider and a health plan that checks claims from the healthcare provider to ensure they don't contain errors before sending them on to a health plan for payment. What's a business associate? It's a person or entity that performs activities that involve the use or disclosure of protected health information on behalf of or provides services to a covered entity. Some examples are contracted nurse practitioner, contracted speech therapist, and on-call answering service. So what is a covered entity? In simple terms, the healthcare provider, healthcare plan, or healthcare clearinghouse. Covered entities are organizations that handle patient information, such as doctor's offices, health insurance companies, or clearinghouses that process healthcare transactions between providers and payers. What's a business associate? Simply put, partners or vendors working with the healthcare provider. Business associates perform services involving patient data on behalf of the covered entity. This can include IT providers, billing companies, or consultants. The privacy rule protects patients' PHI while letting you securely exchange information to coordinate your patient's care. It gives patients the right to review and get a copy of their medical records, request corrections, and restrict their health plan's access to information about treatments they paid for in cash. The privacy rule protects PHI that you hold or transmit, including electronic, paper, or verbal. PHI includes information about common identifiers, the patient's physical or mental health condition, the health care you provide to the patient, and payment for health care provided. Requirements of the privacy rule include notifying patients about their privacy rights and informing them of how their information is used. It requires someone be assigned to ensure privacy procedures are adopted and that employees are educated and trained on those procedures, and the privacy rule requires patient records containing PHI are properly secured so only those who are required to see them have access. The privacy rule allows for the sharing of information with providers such as doctors for treatment, payment, and healthcare operations even without a signed consent form. If a patient is incapacitated, it allows for the sharing of information if it's believed to be in the best interest of the patient, and it allows for the use of email, phone, or fax machines to communicate with other healthcare professionals. Unless a patient objects, the privacy rule also allows for information to be shared with anyone the patient identifies as involved in their care, as well as providing information about the general condition or location of a patient to anyone responsible for their care. Here in Genesee County, patient privacy is important to us. It's also protected by federal and state laws. As a provider, we must comply with all laws and regulations. Our Notice of Privacy Practices explains how we use information. We have designated personnel to assure patient privacy, establish policies and procedures to safeguard patient information, and corrective actions and self-reporting of breaches or potential breaches. Protected health information, also referred to as PHI, is individually identifiable health information that relates to a person's healthcare condition, the provision of their healthcare, or the provision of payment for their healthcare. When any one of the 18 identifiers is coupled with health information, the result is protected health information, or PHI. There are 18 identifiers. The first 9 include patient names, geographical elements such as street address, city, and zip code, dates relating to the health or identity of individuals such as birth dates, admission dates, discharge dates, and date of death, telephone numbers, fax numbers, email addresses, social security numbers, medical record numbers, and health insurance beneficiary numbers. It's important to note that health information by itself without an identifier is not considered to be protected health information. For example, a data set of vital signs by themselves does not constitute PHI. However, if the data set vital sign includes medical record numbers, then the entire data set is considered PHI and must be protected. The remaining identifiers are account numbers, certificate or license numbers, vehicle identifiers, device attributes or serial numbers, digital identifiers, IP addresses, biometric elements, full-face photographic images, and other identifying numbers, codes, or unique characteristics. Another example is an eye surgeon's note describing pre- and post-eyelid surgery by itself is not PHI. However, when a full-face picture is included, it's considered PHI and must be protected. HIPAA gives patients the right to view and obtain copies of their record, and if denied, they have the right to request a review of the denial. Patients have the right to change information believed to be incorrect. They have the right to a list of disclosures from the past 6 years, that is, to whom and when their information was shared. Patients have the right to restrict uses and disclosures of their information. They can request a provider communicate in a manner that protects privacy, and that they have the right to receive a paper copy of the Notice of Privacy Practices. The Notice of Privacy Practices, or NPP, is written information about privacy rights and how PHI is used and disclosed for treatment, payment, and operations. It's very detailed and often between 2 and 4 pages in length. Significant penalties and fines can be imposed if a covered entity or business associate is not HIPAA compliant. A Tier 1 violation carries a minimum of $100 penalty per violation with a maximum of $25,000 per year. This is when the covered entity or business associate is unaware of the HIPAA violation and reasonable due diligence was exercised. Tier 2 is described as reasonable cause and actions were not willfully neglectful. Tier 3 is willful neglect, but attempts were made to resolve the issue, and Tier 4 is willful neglect with no resolution attempted afterward. As you can see from the chart, minimum penalty amounts increase significantly with each tier. There are permitted uses and disclosures of PHI for different purposes within the healthcare sector. It is always permitted to use and disclose PHI for treatment, payment, and healthcare operations. If the reason for disclosing the PHI is not for one of these purposes, an authorization must be obtained. Disclosure refers to the transfer, release, provision of access to, or divulging in any other manner of information outside the entity holding the information. These definitions are applicable to the sharing of electronic, paper, or verbal communications. A significant difference between disclosure and use is that use PHI is internal to the covered entity, while disclosure focuses on external communication of PHI. Any unauthorized or improper use or disclosure, whether intentional or accidental, must be reported to your supervisor or department head. Here in Genesee County, the compliance officer is designated as the privacy officer and is responsible for investigating and initiating corrective actions. All improper uses and disclosures will be tracked and, when required, reported to state or federal agencies. Some examples of improper use or disclosure include gaining access to the record of a family member or acquaintance, sharing a password or logging someone in so they may gain access to patient information, and sending PHI to the wrong office or person. The definition of breach is an act of breaking or failing to observe a law, agreement, or code of conduct. When applied to HIPAA, a breach is any unauthorized acquisition, access, use, or disclosure of unsecured or unencrypted PHI. Countywide Policy GC025, titled Breach Incident Report and Response, sets forth policy and procedure for responding to any breach or suspected breach of protected information. The policy and breach of confidential or protected health information report form are contained in the Policy and Procedure Manual under the Compliance tab. The Policy and Procedure Manual can be found on the intranet. Breaches of PHI can occur when laptops, tablets, or thumb drives are lost or stolen. Other examples include when documents containing PHI are mistakenly discarded or recycled, when someone not authorized to access PHI obtains an electronic or paper record, or when a record is emailed or faxed to the wrong person or office. Patient authorization is not necessary for purposes of treatment, payment, or operations. As a provider of healthcare services, we use patient information in the following ways: to receive clinical information and orders from physicians and other providers, provide information to physicians and other providers, billing for services, and internal processes that include quality assurance, analysis, and monitoring. The HIPAA Minimum Necessary Rule is a key element of the HIPAA Privacy Rule that requires covered entities to practice data minimization and implement adequate safeguards to ensure that protected health information is used and disclosed only to satisfy a particular purpose or carry out a function. The rule limits the number of people who have access to PHI and ensures secure and confidential protection of patient information. As a covered entity, we must implement the rule by creating policies, access controls, and security protocols, providing employee training and awareness, and making sure that reasonable efforts are taken when using or disclosing PHI. The minimum necessary rule does not apply to requests for treatment or laboratory services, disclosures to the patient, when authorized by the patient, or when required by law. There are many ways to protect patient information, such as notifying patients how we will use and disclose their information. We train our workforce. We have well-defined policies and procedures. There are physical and technical safeguards. There's limited access to patient information, and only to what is minimally necessary to perform a job. Business associate agreements to safeguard patient information are in place. We monitor for compliance with laws, policies, and procedures. We investigate and report actual or potential breaches of information, implementation of corrective actions, including discipline, and we have a privacy officer and security officer who provide oversight and guidance. So, what are your responsibilities? You're responsible for safeguarding patient information and being familiar with countywide policy GC024 called Safeguarding Information. You're responsible for following the minimum necessary rule and should always ask what information is needed for this request. It's your responsibility to refer complaints and patient requests immediately to the privacy officer or the security officer and report promptly any actual or potential violations of policies, procedures, and practices. And we expect you to adhere to and be familiar with our HIPAA policies and procedures. Any questions about this HIPAA training, our procedures, or your responsibilities? Contact your supervisor, department head, the privacy officer, or security officer. This concludes HIPAA training.